Hey everyone, it's Caitlin. Welcome back to CoronaChat. Today is Thursday, April 30th, and right now on CoronaChat we're doing a mini-series, right, comparing different countries' responses to the coronavirus pandemic. And I explained how we're going to do this comparison yesterday, so if you haven't seen yesterday's video yet, go back, do that first, and then come back. Okay, so today we're going to talk about the first group of countries, which used massive testing, contact tracing, and selective quarantine to control the spread of the virus and avoid a shutdown. Right, so the two best examples of this strategy, though other countries have also done this, but the ones we're going to talk about today are Singapore and South Korea. Now, the idea behind this strategy is that you test everyone, or as close to everyone as you can, and then you ask everyone who had a positive test to go do the quarantine for 14 days. Each of those people is asked to generate a list of everyone they might have potentially infected. For coronavirus, that's everyone with whom they've had close and prolonged contact over the last few days. So we're talking, within 6 feet for more than 10 minutes. And to provide that list to their local public health officials. So those public health officials then go and contact everyone on that list to let them know that they've been potentially exposed to the virus and ask them to quarantine at home for 14 days. They don't tell the people on the list who exposed them, right? So to protect people's privacy, they just tell them that they've been exposed at some point. And in this way, you can control the spread of the virus without needing to shut everything down. However, this strategy requires a couple of things, right? So first, you need to have large-scale testing. South Korea, for example, began manufacturing tests in mid-January, when the World Health Organization first shared the German-developed test kit blueprint. So South Korea didn't have a real outbreak of COVID-19 until mid-February. So by the time people started getting sick, they already had a huge stockpile of tests that they were able to deploy and immediately start testing people. So second, you need trained contact tracers. Contact tracing is a real skill. You have to be a people person and you have to be really empathetic. People have to feel safe sharing with you that they maybe broke the shelter-at-home order to go see a family member, or be willing to share, some maybe embarrassing places or people they might have had contact with. And you need to be able to persuade people, the contacts, right, to all stay at home for the greater good of society, even though they don't feel sick yet. Luckily, most countries already have contact tracers for things like HIV and syphilis, which can be even more delicate and uncomfortable to talk about than coronavirus. So this is a core public health function that most countries are actually already able to do. We might need to train more contact tracers, but we know how to do this. Third, you need places to quarantine people. As we're all learning, quarantine at home is really hard, like really, really hard, right? Trying to truly stay separate from people you live with is tough, and especially if you share a small space or you live with young children. But because of their experience with SARS, Singapore had already built special quarantine hospitals, which is where anyone who tested positive went to ride out the duration of their quarantine. And this way they didn't have to worry about going out to get groceries or worry about potentially infecting their family members who were trying to take care of them at home, right? And Singapore's government, by the way, underwrites the cost of hospitals. So people didn't have to worry about getting hit with a huge bill at the end of their quarantine stay, right? Okay, so 4, you need good logistics and organizational support. Keeping track of all the people who are sick and who may have been exposed is a lot of work. Think back to your own life pre-corona. How many people were you in contact with on a regular basis that you would have had to have put on a contact list if you were asked to put one together, right? So I work at a university and I regularly come into contact with dozens of people a day, and more if I have classes, right? So if even as few as 50 people test positive, this is a real Herculean effort to try to, trace and quarantine all of those potential contacts. And this is why countries with really large numbers of COVID cases, like the US, Italy, Spain, chose to go into, kind of society-wide lockdown instead of doing testing and contact tracing. Logistically, it's just too much. South Korea and Singapore both use technology to try to speed up their process and make it more efficient. And they developed algorithms that help contact tracers use data from things like surveillance cameras and cell phone location data and credit card transactions to try to identify additional people who might have come into contact with people who tested positive. This seems to be working very well in those countries, but it may be really invasive for others. So, rest assured that this doesn't need to happen for contact tracing to work well, right? We do contact tracing all the time for other kinds of illnesses without having this kind of granular data. But every society has to kind of make that trade-off between, privacy and how much information they want to know. Do you want to know 100% for sure every single person that someone could have come into contact with, or are you okay knowing 80% of those people? Okay, that's our show for today. Tomorrow we'll pick up with the next group, those countries like Australia and New Zealand that used a short-term lockdown to kind of get things under control, so then they could reopen with contact tracing in place. So look forward to seeing you all tomorrow for that video. And until then, remember, we're all in this together. Stay safe and take care of each other.